good day, sir. I'm reference Biner Baso from BSN1B, and today I'm going to demonstrate how to perform breast and axilla examination. So first, let's define the breast. Breasts are paired mammary glands that lie over the muscle of the anterior chest wall. So the purpose of this assessment is to early detection of breast cancer, to prevent breast cancer prevalence, to improve prognosis breast cancer, and lastly, to evaluate healthcare plan for the breast cancer patient. So, we have the special consideration. It is important to provide client privacy by closing all the curtains, windows, and doors. So, the rationale for this procedure is for the patient to be comfortable in the whole procedure that we are going to do. And then I'm going to gather all the materials needed, including the centimeter ruler, the small pillow, gloves, slide for specimen, and client handout for breast self-examination. And of course, it is important to perform hand washing before and after the assessment to prevent cross-contamination of microorganisms from nurse to patient and vice versa. And before the assessment, we need to introduce ourselves first, to identify the client, and explain the procedure to the patient. So, good day po ma'am, I'm reference Nervasa, your student nurse for today. So, today po ma'am, I'm going to examine your breast. So, in order to do that po ma'am, I will be needing your cooperation para mas maging accurate po yung gagawin nating assessment for today. It is okay with you ma'am? Thank you po ma'am. So, before we start ma'am, gusto niyo muna po bang mag-CR muna? Okay po. So, ma'am, pwede na po kayo mag-change in patient gown or in hospital gown po para mas maging komportable po kayo. Then, para mas padali po yung gagawin nating assessment for today. So, for assessment of the breast examination po, i-apply po natin yung inspection and palpation. Yung sa inspection po, sir, dito po natin ginagamitan ng visual senses po natin para ma-inspect po yung patient. So, sa inspection po, sir, ini-inspect po natin dito yung sa size and symmetry, sa color and texture, the superficial venous pattern, and the retraction and dimpling. So, sa retraction and dimpling po, pwede po natin ipagawa sa patient kung raise both arms against the hips together. Then, lastly, the lean forward from the hips. So, sa step po yun na sir, mas makikita po natin yung kung may any abnormalities po ba dun sa breast ng patient. So, dun sa size, shape, color, and texture ng areola po. Then, dun sa size and direction po ng nipples ng patient. So, meron din po tayong consideration pag ang patient po natin is older adult. Dahil po, yung breast po nila is medyo saggy na po, or kumbaga po, sir, is laylay na po. Normal findings po is kailangan po smooth yung texture ng breast, then without sign of edema. Then, dun sa color naman po ng breast is nakadepende po dun sa skin color ng patient. So, halimbawa po, kayo manggi po yung skin tone ng patient, dapat po kayo manggi din po yung kulay ng breast ng patient. So, sa palpation naman po, sir, dito naman po natin ginagamitan ng sense of touch po natin. Meron po tayong method 1, which is the clock pattern, the 369, then sa method 2 naman po, pwede po nating hatiin sa 4 quadrant po yung breast ng patient para mas ma-determine po natin kung saan po ba may abnormalities yung breast ng patient. The upper inner, the upper outer, the lower inner, and lower outer. May tatlo din po tayong technique sa pag-palpate ng breast ng patient. First is the parallel and is the spokes on a wheel. And last is the concentric circle or the circular. Sa pagpalpate po ng breast ng patient, gagamitin ko po yun sa clock pattern po, which is the 36912. Pagpalpate naman po ng breast ng patient, dito po natin texture and elasticity, yung tenderness and temperature, then yung masses, kung may present po ba ng masses, yung breast ng patient. Note po sir dun sa location, size, and shape, mobility, consistency, and tenderness. Then, ipapalpate din po natin yung nipple ng patient and observe for any discharge. Assessment of male breast naman po sir is same lang din po dun sa pag-assess natin sa female breast. So, inspect for the size and symmetry, for the color and texture, then palpate breast, areola, and nipple, and observe for swelling, nodules, or ulceration. So, ma'am, we're done na po sa assessment of your breast po. Now, we're going to assess, ma'am, your axilla po. Is that okay with you po, ma'am? Inspect for rashes or infection po. Then, I'm going to palpate firmly the axillary node and palpate for the anterior, posterior, medial, lateral, axillary nodes. After the procedure, the examination that we do, it is important to thank the patient for his or her cooperation. Then, after the procedure, the examination that we do, it is important to thank the patient for his or her cooperation. Then, cover the patient, help them to get dressed if necessary. Position the patient in a comfortable position. Pwede po in supine position or in semi-high position. Depende po sa kung saan comfortable yung patient. Then, kung naka-gloves po na tayo, kailangan po natin yung i-dispose. Then, like I said earlier, it is important to perform hand washing before and after the assessment. Tapos po na ma-assure natin yung kung comfortable na po yung patient natin, then kung wala na po siyang ibang kailangan, pwede na po tayo mag-documents ng findings.